Let's meet an inspiring trailblazer leading the charge in the fight against breast cancer. I'm Kate Save. The Inspired CEO starts now. Welcome to The Inspired CEO, where each episode we explore the innovative wellness practices that are driving success and longevity in the modern business world. In this episode, we sit down with a specialist breast surgeon specialising in oncoplastic surgery and the founder of Australian Breast Care Centre, specialising in early detection and surgical outcomes for breast cancer, particularly in women under 50. An advocate for genetic testing and MRI access, she enhances patient care through her roles in medical organisations and collaboration with cancer research institutes. So welcome, Dr. Nicole Yap.
Thank you, Kate, for having me here.
It is such a pleasure, and what you have achieved in your career is absolutely remarkable. But take me back to the start. What was your passion for getting into breast surgery, I guess?
Well, I, being female,
Yes.
love the aesthetic aspect of anything, not just surgery, but anything. And so I started off training in plastic surgery, thinking, oh, this is where I belong. But within plastic surgery and aesthetic work specifically, there's a few issues with some people's minds as to how they see themselves. And as I went along in the training, I realised that there must be in medicine more to it. And if you think about aesthetic side of things of the female body, you think about breast.
Yes.
And so we also know that breast cancer is the second most common form of cancer that women will have after skin cancer.
Yes.
So I thought, why not combine the two?
Fascinating. And in terms of your journey, I guess it's an interesting career choice, and particularly for a female. There weren't obviously as many female surgeons as there are now, and so you would have been leading the space out here, particularly in breast onco surgery as well. So tell me a little bit about your personal journey.
Well, you're quite right. Currently, even now, and I've been training for a little bit, it only 12% of all the surgeons in Australia and New Zealand, the College of Australasia, and that includes, of course, New Zealand, we only have 12% are female.
Wow.
So you can imagine it's been a steady build-up, and within that area, you know, I'm very outspoken, and that's not to be expected from the trainee. So I got into trouble a few times in that respect.
That's why we love you so much.
And that's always a challenge. And then, you know, there's also, and it was probably more well known about some years ago when some female surgeons came out and said there was a lot of sexual exploitation and this, that and the other. Well, you know, there was, and I'm not denying it, but that was also a challenge to overcome and still manage without having that exploitation to actually achieve being a surgeon. Because I recall at one stage I was told by a male senior surgeon, because I didn't quite like his advances, that I would never do surgery. So I said, well, see about that, under my breath. I didn't say that to him. That was one of the few occasions I wasn't outspoken. But they were the first challenges. And then as you do get into training, it's actually quite an arduous time, because you spend a lot of time at the hospital. And I probably spent a little bit more because I really wanted to keep training and learning. So I did a lot of overtime that was unpaid, not because the hospital said that, but because they allowed me to, so that I could get more experience. Because it's really the experience, not just of doing the work, but also of knowing how to fix problems. Because with surgery, you're always going to have a small percentage of people that have some issues, complications, etc., which is well known. But acknowledging that, knowing when it might or may not happen, if it's happening, how do you correct that? And that's what makes you into a good surgeon.
Yeah, and you're also very passionate about prevention, hence why you started the Australian Breast Care Centre.
Yes.
And you're passionate or an advocate for genetic testing. So tell me a little bit about that.
Well, it started with when my girlfriend at an early age passed from breast cancer, and that was before I wasn't treating her. She actually, she was interstate when she was diagnosed and treated there, and so on and so forth. And I then realised that during COVID that there was a lot of young women seeking medical advice because they needed to get out of their home.
Right.
They needed to get away from the young children that were sitting at home, especially in Victoria, because we had 222 days of lockdown.
Not counting.
Yes. And so they just needed relief. So they found something like breast pain or something like that to get away from the home. And I was diagnosing all these women in their 30s and 40s.
Wow.
And this was amazing. And so I would say I was operating on one woman a week with breast cancer in this age group. So I then thought, why are these age groups becoming so prevalent? And I realised that 23% of all breast cancers are under the age of 50, and they are not well diagnosed. One, because people think, well, you don't really get a breast cancer in that age group, or two, you've got dense breast tissue, so it's harder to find, and with the usual ways of doing it, such as mammogram and ultrasound, and hence why I want to push MRI, because that's an excellent way of 98% sensitive of diagnosing a breast cancer. So, but it's not readily financially available to everyone, and that's what we need to overcome. So that's another thing. With regards to genetic testing, I found that of all the breast cancers that were diagnosed last year, for example, in Australia, which was 22 and a bit thousand, of those, only 15% had a family history. God. That means 85% have no idea what their risk is. And then I worked out, how can we address this? And I found, what about using polygenic scores, which is a way of using the gene side of things. It's groups of genes that we look for that are more prevalent if you're going to develop a breast cancer. So I have been pushing, work out what your risk profile is, because breast density and family history are all very well and true, but it's not the be all and end all. And then once we know what your risk is, I can then develop a tailor-made management plan for the individual, rather than saying, oh, you have to do this every 2 years, or you know, for every single person, because not every single person needs it.
Yeah, and then you're wasting expenses, and
that's
those
right.
expenses could be put into preventative care. And
correct, and that's why I started Australian Breast Care, because I decided, the Breast Care Centre, because I decided that we needed some forum to enable people to go to, or be a clinic where you can actually come and try and work out your risk profile, then be managed, and then maybe if you do unfortunate enough to develop breast cancer, you could have oncoplastic surgery.
So, and my understanding of that is you are actually removing the cancer at the same time as putting in the new breast. So instead of women waking up with scarring and no breasts and walking out absolutely deflated, they actually walk out feeling good about themselves with a bit of confidence.
Correct. You know, you're on top of it.
I just love what you do, and I think it's just the mental health aspect of that is huge, and it's really understated, and it's something that perhaps when they're looking at this funding, they need to consider when you look at the state of particularly Victoria and mental health post-COVID as well. So very important. Now, talking about your demanding career and how you manage your health, you are extremely healthy, and tell us about your health routine.
I may not be extremely healthy, but
You're
I do my best.
Fit. You are so fit. It's unbelievable.
Well, I really don't have a routine, because it's difficult to have a regular routine is difficult in my line of work. However, I do like certain sports, and I don't get much chance to really practice them or do them, but I'll have to do cycling.
Yes.
So one way to do cycling for me is to get myself out of the country so that I can actually do the cycling.
Great idea. Yes.
So that has led me to cycling trips in Slovenia, more recently in most remote Thailand. We cycled 520 kilometres in 5 days to raise funds for an orphanage there.
Incredible.
And I've met some amazing people doing that. So it's not just doing being fit and getting out there in the elements. It's also a way of meeting really interesting people, and on top of that, I can try and maintain a level of fitness.
And you're not competitive at all.
No.
I've seen you compete, and I guess looking back on your career, you've achieved so much, but what is your proudest moment? What would you reflect back on and go, I'm really glad that happened, I'm proud of it?
It's interesting, there is no one moment, because my career has been very fluid, and within that there's been multiple moments, and that's when I have patients come to me and say, after we've treated them, and this sounds really weird, but don't take it out of context, but they actually said to me, breast cancer is the best thing that's happened to me, quote unquote. And I just look at them like, oh, I don't really think you should be doing. One was a journalist, and she wrote that actually in one of her, she was writing in a magazine. And I said to her, why do you say that? And she said, because I've met you, I was severely overweight, chemotherapy sorted that bit out, but then also I look better, feel better, and I've maintained that. And there's been someone else that just recently, she's only in her 40s, or actually both of them, there's two that came at a similar time. I had done a bilateral mastectomy, meaning I'd removed both breasts. The scar was hidden underneath, so no one would know that I actually had cancer surgery. And then at the same time, I reconstructed them. And one came in just recently for a checkup, and she said to me, oh, I'm now the face of Daffodil Day. Now, before that, she was just doing regular things. She said, oh, I have to go and do this, that, and the other, but now I'm the face. And I went, good for you. The second one was having massive issues with coming around to the fact that she had to have mastectomy, and I just got a photo. She's in Magnetic Island in this bikini showing me her cleavage, her new cleavage. My cleavage, I said, that's mine.
Well, congratulations on doing such fantastic work and making people feel better about themselves in moments of severe trauma, and making that experience one that is life-changing and far more positive. So this is Ticker, and we will be right back.
You're watching Ticker. We'll have more in just a few minutes.